Endometriosis is a chronic and often painful condition that occurs when tissue similar to the lining inside the uterus, called endometrium, starts to grow outside the uterus. This misplaced tissue can be found on the ovaries, fallopian tubes, outer surface of the uterus, and even on organs in the pelvic cavity, such as the bladder or bowels. In rare cases, endometriosis has been found in other parts of the body, including the lungs and brain. During a typical menstrual cycle, the endometrium inside the uterus thickens in preparation for a potential pregnancy. If pregnancy doesn't occur, this lining sheds and is expelled from the body during menstruation. What sets endometriosis apart from other conditions is that the endometrial-like tissue outside the uterus acts just like it would inside the uterus. It thickens, breaks down, and bleeds with each menstrual cycle. However, because this tissue has no way to exit the body, it becomes trapped, leading to inflammation, pain, and the formation of scar tissue. Endometriosis is more common than many people realize. It affects approximately 1 in 10 women of reproductive age, which translates to around 176 million women worldwide. Despite its prevalence, it is often misdiagnosed or underdiagnosed because its symptoms can mimic those of other conditions, such as irritable bowel syndrome, IBS, or pelvic inflammatory disease, PID. Causes of endometriosis. The exact causes of endometriosis are not fully understood, and it's likely that multiple factors contribute to its development. However, several theories have been proposed to explain how endometriosis occurs. These theories include: Number 1. Retrograde menstruation. This is the most widely accepted theory. It suggests that during menstruation, some menstrual blood containing endometrial cells flows backward through the fallopian tubes and into the pelvic cavity instead of out of the body. These displaced endometrial cells then implant and grow on the surfaces of pelvic organs. Number 2. Coalomic metaplasia. This theory proposes that cells lining the pelvic organs, called peritoneal cells, can transform into endometrial-like cells under certain conditions, such as hormonal influences or immune factors. Number 3. Embryonic cell transformation. This theory suggests that embryonic cells left over from fetal development may transform into endometrial-like tissue during puberty when estrogen levels increase. Number 4. Lymphatic or vascular distribution. This theory proposes that endometrial cells may be transported to other parts of the body through the lymphatic system or blood vessels. Immune system disorders are also thought to play a role in the development of endometriosis. Some researchers believe that endometriosis could be linked to a dysfunction in the immune system, which might not be able to recognize and destroy endometrial-like tissue growing outside the uterus. Other than that, hormones, particularly estrogen, appear to promote the growth of endometriosis. This is why endometriosis tends to be less common after menopause when the body's estrogen levels decrease. Additionally, some believe that surgical procedures, such as a hysterectomy or C-section, may accidentally move endometrial cells to other areas of the body. Symptoms of endometriosis. The symptoms of endometriosis can vary widely and depend on the location of the endometrial tissue. The most common symptom is pelvic pain, which is often associated with menstruation. While many women experience cramping during their menstrual periods, those with endometriosis typically describe menstrual pain that's far worse than usual. Pain may also increase over time. Some women report feeling as though their pelvis is on fire or being stabbed repeatedly. Women with endometriosis often report pain during or after intercourse, which can be persistent. Pain during bowel movements or urination is another symptom, especially during menstruation. It's not uncommon for women to experience excessive bleeding. This can include heavy menstrual periods or bleeding between periods. Endometriosis can also lead to infertility. About 30 to 50% of women with endometriosis have difficulty getting pregnant. The condition can affect fertility in various ways, such as causing anatomical distortions that impair the function of the reproductive organs. Other symptoms include fatigue, diarrhea, constipation, bloating, and nausea, especially during menstrual periods. The severity of symptoms is not necessarily indicative of the extent of the condition. Some women with severe endometriosis may have mild symptoms, while others with a mild form of the disease may have severe symptoms. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of endometriosis. Diagnosing endometriosis can be challenging, and many women experience a significant delay between the onset of symptoms and receiving a diagnosis. On average, it takes 7 to 10 years from the time a woman first experiences symptoms until she receives a definitive diagnosis. This delay is due to several factors, including the normalization of menstrual pain, the overlap of symptoms with other conditions, and the invasive nature of the definitive diagnostic procedure. The first step usually involves a thorough medical history and a pelvic exam. During a pelvic exam, the doctor may feel for large cysts or scars behind the uterus. Imaging tests such as ultrasound or magnetic resonance imaging may be used to visualize the reproductive organs and look for signs of endometriosis. These tests can sometimes detect endometriotic cysts, called endometriomas, on the ovaries, but they often can't detect smaller areas of endometriosis. Blood tests may be performed to check levels of CA-125, which is a protein that can be elevated in women with endometriosis. However, this test isn't specific to endometriosis and can be elevated in other conditions, so it's not used as a standalone diagnostic tool. The gold standard for diagnosing endometriosis is laparoscopy, which is a minimally invasive surgical procedure. During a laparoscopy, a thin, lighted tube with a camera on the end, called laparoscope, is inserted through a small incision in the abdomen. This allows the surgeon to visually inspect the pelvic organs for signs of endometriosis. If endometriosis is suspected, a small tissue sample, biopsy, may be taken for laboratory confirmation. Treatment for endometriosis. Treatment for endometriosis typically involves managing symptoms and improving quality of life, as there is no cure for the condition. Pain management is a primary goal in treating endometriosis. Over-the-counter pain relievers, such as nonsteroidal anti-inflammatory drugs, can be effective for mild pain. For more severe pain, prescription medications such as hormonal therapies may be recommended. Hormonal treatments work by reducing or eliminating menstruation, thereby slowing the growth of endometrial tissue and preventing new implants from forming. Options include hormonal contraceptives, such as birth control pills, patches, and vaginal rings, which control the hormones responsible for the buildup of endometrial tissue. Gomadotropin-releasing hormone agonists and antagonists are another option. These medications reduce estrogen levels, creating a temporary menopause-like state. As a result, menstruation stops and endometrial tissue shrinks. However, because they induce menopausal symptoms, their use is typically limited to a short duration. In cases where hormonal treatments are ineffective, or if a woman wants to become pregnant, surgical options may be considered. Laparoscopic surgery is commonly used to remove as much endometrial tissue as possible while preserving the uterus and ovaries. This surgery can help reduce pain and improve fertility. However, endometriosis can recur after surgery. For severe cases of endometriosis, a hysterectomy or surgical removal of the uterus may be recommended. In some instances, the ovaries are also removed. This procedure is typically considered a last resort, especially for women who still wish to have children. Lifestyle changes and self-care strategies can also help manage endometriosis symptoms. Regular exercise can help reduce pain by releasing endorphins, which are natural pain relievers. Some women find relief through complementary therapies, such as acupuncture, chiropractic care, and herbal supplements, although scientific evidence supporting these treatments is limited. Now, we want to hear from you. Do you or someone you know have endometriosis? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.